I'm Dr. Stephen Hotze. I'm here with Michelle Iserman. And Michelle has been a guest of ours since 2010, and I just wanted you to hear her story. Michelle, how did you first hear about us, and what made you decide to come in?
Well, the short story is Providence, right? But my dad had been here years ago for his thyroid issues, and he mentioned your name to me over the years. And then I had gone to a naturopathic doctor for about 8 years and didn't get the relief I needed. So I was looking for other answers and saw your ad on a Southwest Airlines magazine.
Really?
Yes, and it caught my eye. So I thought, okay, that's an answered prayer. I'm going to make an appointment. And I came in and saw Dr. Ellsworth the first time.
Now, what kind of symptoms were you experiencing, and how long had they been going on?
Gosh, I was probably premenopausal. So just a lot of irritability, and I had low thyroid. So the combination of both of those with
So you had fatigue and difficulty with
adrenal
weight?
fatigue and weight gain, and just hard managing stress and brain fog. And
All the common symptoms we see.
yes, I did not know all the thyroid symptoms mimicked the hormonal symptoms until I came to Hotze.
And you came in 2010, and now had you seen other doctors about these problems, and what had they recommended?
Well, when I first was on my mission to health, I had, seen my gynecologist. I'd seen a regular doctor, and they would tell me my blood levels were within the normal ranges.
Right, which they always do.
Right.
And did they recommend any medication?
An antidepressant.
Which is common.
Yeah.
It's very common when doctors can't resolve problems or don't know what causes them. They go undiagnosed. And hormonal problems and low thyroid, which of course is a hormone, they have classical symptoms that we see. But if the doctor's not trained to recognize and treat based upon the symptoms, they'll look at blood work and they go, well, your blood work's normal. I guess
Right.
you just need an antidepressant.
Right. I got that multiple times.
Right.
Yeah.
How did that make you feel when they said they wanted to put you on an antidepressant?
Oh, gosh, my goodness. Yeah, you don't really want to do that. And you read the list of side effects, and they're pretty awful in themselves, too. It's like, I don't need that on top of everything else I'm battling.
That's exactly right. So you saw Dr. Ellsworth, and how long did it take you? And I'm sure he put you because of your age and your symptoms. He started you on some thyroid and some progesterone, maybe some cortisol to help support
Yes,
the
sir.
adrenal glands, and some
Right.
vitamins, good eating program.
Yes, sir.
How long did it take you to begin to feel better?
I probably felt better within the first 3 to 6 months when everything sort of started to take effect, and I could feel a distinct difference and an improvement.
And how have you done since then?
I've done great. This is the best I've felt probably in my adult life, really, since, before having my child. He's 19. So, yeah, it's been a while.
Going back to when your child was born, did you notice a change in your metabolism and the way you felt after that?
After I stopped breastfeeding, I did.
Yeah.
Breastfeeding was great. Burns a lot of calories. But,
Yeah.
boy, once you stop that, you got to
Really
decrease your calorie intake.
Well, I want to commend you because you decided to take charge of your health.
Thank you.
And although we may have made some recommendations, you had to follow them. And if you hadn't have done that, you'd be where you were back 5 years ago. And imagine what you would be like.
Oh, yeah.
Huh?
I've lost 11 pounds since this last visit a year ago.
Wow.
And that's just getting my health in order, not even
Well,
just
you
trying
look-
to eat right.
You look great, and I'm so
Thank
proud of you, and congratulations
Thank
on
you,
your
Dr.
success.
Hotze, for everything
Okay.
you've done.
You